Good morning.
Morning.
It's the 12th annual British Columbia Lung Association Air Quality and Health Workshop. I'm Veda Peters, one of the educators with British Columbia Lung Association, and I'm here with Dr. Larry Frank from University of British Columbia, and we're going to talk about community design. How does design affect mobility choices? Community design, that is, of course. Mm-hmm.
In a number of ways. First of all, where we live determines how easy it is to walk to a shop, if there's a store nearby, if it's a walkable pathway. It's fairly intuitive. Community design has an effect on travel by determining the presence or absence of choices for how to get around, and the presence or absence of destinations to get to. So it's both the ability to walk and bike and take transit. Is transit present? Is it easy to drive? Is it easy to walk? Is there a sidewalk? Can I bike? Is there a safe place to bike? All those things are determined by the way your community is designed.
And what effects does community design have on health?
Well, if you live in a neighborhood that we call more walkable, and I'll show some examples here. So first of all, the way that this path model I'll use shows if you build transit infrastructure or road infrastructure, you get automobile-oriented development or transit-supportive development. Developers make decisions about where to build and what to build based on the transportation investments that we make. So if, for example, we were to pass a vote that's currently underway for a transit referendum for basically $7.5 billion over the next 10 years, which sounds like a ton of money, but actually it goes in lots of directions with $750 million a year, would make it possible to build that transit pathway that would allow people to walk more, because transit riders walk because they have to. Because transit doesn't go right to your door. You got to walk about 10 minutes, 5 to 10 minutes to get to it typically on either side, and you go to work and you get 20 minutes, 10 minutes before, 10 minutes on the other side of getting to work, and 20 minutes again, 40 minutes a day. We need about 30 minutes of moderate physical activity to reduce health risks, to reduce chronic disease. So people using transit are getting it, and those that don't use transit have to find other ways to get their physical activity, because driving is not a physical activity. It may be stressful, but it doesn't burn a lot of calories. You're sitting and being sedentary. So the effect is through the mechanism, which is the choice of travel. Active travel, walking and biking, human-powered, gets you physical activity. Physical activity gets you health outcomes. And according to this path model that I'm going to show here, impacts our cost, impacts our budget. Chronic disease is accountable for one of the largest proportions of the provincial budget. It's huge and growing quickly. We have an aging population that are predisposed to developing chronic disease. So if we can get the people active, we can reduce the amount of chronic disease, and we can reduce our healthcare costs enough so that I believe it might offset and actually even cover the cost of the transportation investment, and maybe help us even more than that, because we get economic benefits as well in other ways from transit investment and pedestrian infrastructure. So that's this model, and here's an example. Here's two neighborhoods on the top. One is disconnected, and the one on the right is connected. The one on the left is a single-use, single-family, residential-only neighborhood. And that squiggly line in the middle, maybe this will show through. Do you see in the cursor that I'm using? But basically, I'm drawing an outline around the neighborhood. That's what this person who lives in this household, so this is where you live, that's what you can get to within a kilometer from your house. You can, even though this is closer, this neighborhood, and this one, it's disconnected. You can't get through. That is intentionally built that way to create what's called defensible space. To keep people from walking through your neighborhood you don't know. To keep travel and cars from going through. So you get your quiet street, but you don't have anything nearby that you can get to. That's a problem, because that means you're not going to walk much to go places.
And you get motorists lost once they get into those neighborhoods and can't find their way out.
They're intentionally designed that way, and they use special street names that are all the same, like Torrance Place, Torrance Park, Torrance this, Torrance, anyway, so it goes on.
I've noticed that. I've been in one of those mazes.
So on the right, you have what's called a heterogeneous neighborhood, where you've got complementary land uses, live, work, play, and you can actually get around in that neighborhood, accomplish most of your local needs, like food, entertainment, shopping for, could be health care provided, services like that, and recreation and open space, all right there in your back door. So that's what we're seeing people want. I'm going to get to that in a minute. So basically, and then we get a connected streets or disconnected streets on the bottom, is the difference of having a 1 kilometer or 2 kilometer distance to get to a destination nearby. So the lower left panel shows a 2 kilometer walk from point A to B, from you to your friend's house. And A to B is the same airline distance on the right, but the road network is connected. That means a 1 kilometer walk is something most people would be willing to do, but not the 2 kilometer just to go around the corner. We don't tend to like having to walk out of our way. So having and knowing that where you want to go is straight ahead that way and you've got to go all the way around that way, that's the end of it. You're in your car. If you have one, you're done.
Nobody takes the long way around if there's a shortcut.
End of story. Right. So, so we see, I'm going to just jump ahead and talk about that, this demand. We just did a study in Vancouver. 1,200 people roughly found 1 out of every 3 people in automobile-oriented neighborhoods in our outer metropolitan region area, not central Vancouver, in automobile-oriented places would prefer to live in a transit-supportive environment. Why are they there then? Price. They're driven to qualify. So we have an unmet demand for something that actually would predispose the people to being healthier. And in fact, they have latent demand to be physically active and want to be, which is good, but they can't manifest it through their choices of where to live. We have a supply issue. We are undersupplying walkability relative to the demand for it. 60% of survey participants stated a willingness to trade off features of their automobile-oriented environments for walkable communities well served by public transit. So we talk about how does that save us money? Well, for every additional 1% of people in our region that meet the physical activity guidelines, and we can see that transit would help them do that, we would end up with around a $20 million savings in annual economic benefits from healthcare costs reduction. So that's 1%. We need $250 million for the transit referendum, or let's say 240, shave off 10 million. That's a lot, but let's just say for argument's sake, or let's throw in another one, and let's say a 13% increase will get us $260 million, for example. So these are fairly modest numbers, and they are achievable, but you have to build the transit infrastructure, and you have to build the pedestrian and the walk. You can't get a compact, walkable community without transit investment. It doesn't happen. Developers don't build density without transit. So in the transportation system doesn't work because you end up with a lot of people packed in driving.
But transit doesn't have to be buses. Transit can be ride sharing. Transit can be bicycles. Right. Active efficient, sustainable transport includes an important relationship and should facilitate a direct connection between pedestrian and transit and between cycling and transit. The best, most efficient, time-competitive mode is transit with cycling. Because you can get out. So bringing bicycles onto the train, getting off and just going, or having bike sharing at the transit stations results in a very time-efficient manner for people to get around. And it makes the transit system more competitive and efficient as well because they capture more riders from a larger service area. The bike increases the distance from which people, based on time constraints, will be able to get to the station. That's interesting because I would assume that most people think that public transit means more buses, and that's not what I'm hearing.
Public transit means more rail infrastructure, means more buses as well. But we're talking here right now about a significant investment in Surrey and in Vancouver for rail, right? But there's 400 buses as well. I mean, the frequent transit network here covers a lot of the region, right? And this would increase the coverage and reduce travel time on that network considerably. One of the things we know is that travel time is the key. So this is an example. For example, the bullet on the bottom, the proposed investment that I just mentioned, being voted on here now through our referendum, will provide access to the frequent transit network for 70%, the objective in that they have enough funding to do for 70% of the region's population. And that would save 20 to 30 minutes per day. Who would save 20 to 30 minutes per day on some of the most congested corridors? So we know that people will use transit if it saves them time. Because what we care about is our time. So the top bullet shows a study we did in Seattle, published in '07, that a 10% reduction in travel time on transit, which you would get from investing in it by making it more time competitive, was associated with about a 4% increase in its use and a 3% increase in walking. So walking goes up from transit going up. That was observed in the Seattle study, as we would expect. And you start to see these relationships. And then we see here in Vancouver, residents of our most walkable transit-supportive neighborhoods are nearly twice as likely to use transit. So that's, so these relationships are somewhat, if you think about them, kind of intuitive, but they're measurable, and they're having cost implications that are significant in terms of, well, quality of life, in addition to the fiscal impact.
So if you design communities so that people can work, live, and play there, then that reduces a need for commuting to get anywhere, to destination shopping.
Other than work.
Yes.
Yeah. In fact, or to go to a show or to go to the airport. There's always trips that are regional, and the work trip is usually the one. But you can eliminate the need for regional travel, or you can shorten trip lengths significantly, and energy costs and greenhouse gas emissions and air pollution significantly by providing mixed use. You just reduce the distance people need to travel to get to accomplish their daily needs.
Well, I think that if this referendum were presented more in terms of dollars saved and benefit, I think more people would be on the yes side than are on the no side at the moment. But that's a whole other discussion.
Well, there's been a lot of effort to make that happen, and it's a complex political situation, boondoggle, that we're in, and we've been given a tough situation by the way that the province and TransLink interact. Make it very difficult here for the voter to really kind of know, what should I do?
They haven't really made a very good case for it.
No, and we end up with we have a lot of problems in Canada with transportation because there's no federal role in transportation, so it's all provincial, and there's really no backstop. So depending on the politics and the wishes and the leanings of the current administration, government, you have different things happen. TransLink has been through a 10-year, really difficult history here, and this is just one more chapter in what is a very tough saga here.
And community design in the future, is there possibly some way to take those defensible communities and add components that make it more walkable?
Totally. We can retrofit existing neighborhoods, and the new if nothing else, the new places we build should be built so that there's options. There's no better argument than the demand characteristics of the population that are choosing where to live. That even regardless of the health benefits and regardless of the financial benefits, we ought to build based on what we understand consumers say they want. And we have to understand what's going to not only make them say they want it, is going to make them choose it. And that involves cost, and cost is a function of supply versus demand. Right now the demand is great, and the supply is small. So if you own a house in a walkable neighborhood, a single-family detached house, you're golden. That thing is just going up like skyrocket right now. And if you're near a train station, all the better. So we have this very limited commodity. So the better example is the density. So building our train stations, for example, look at King Edward and Cambie, or look at Broadway and Cambie. What's on top of that station above it? Nothing. Yeah. That's the best spot in the region. Those spots are every single study ever done. People have to go literally through the station to get to the street or near it. Those people are your best customers. So we don't even use the air rights above our transit stations yet, effectively. We don't need to, because there's so much latent demand for transit. The system, the Canada Line, we know the numbers are off the charts. The thing is already projected way past. We're concerned there's not enough capacity in it. We just built it. We're in a very unusual situation. No other North American city has that. We have excess demand. So buses pass by on Broadway, 2 to 3 buses during peak, and people are just standing there who are doing the right thing, using transit, and a lot of them say, and this happened to us, heck with that. My time is worth too much. I'm going to find another way to get to work. I can't wait.
Back to my car.
Or we even moved over so we were near the 25, which is King Edward.
Yeah.
We moved away from Broadway. But it's a silly thing because on a per individual or passenger trip cost, it's fairly efficient investment to make transit work. The numbers seem extraordinary in today's dot where if you make it like it's $3 billion to build the Broadway line. Well, over what period of time is that investment then benefit realized? 50 years? So that and the problem is the political decision-making process is set up so that the decision maker wants that investment on their clock to show the benefit of their efforts, which is a reasonable thing for an elected official. But building transit takes time, building roads faster. So that's always been an issue for us.
Well, thank you very much. This gives everybody a lot to think about in terms of how they get around their communities and how their communities might be designed to correct mistakes made in the past, I think.
Yes. Well, when developers show up in your neighborhood and want to build something that has some density to it, before you just say, no, not in my neighborhood, think about it a little bit more and listen to the arguments that are there, because that development might be what you need to get the shops and services you want. Because vendors and owners of businesses like customers, and the best customers are those that live right nearby. So in order for more people to live nearby, you're going to have some density in your neighborhood. You can't have the shops and services without the density for locally serving development, the retail.
Thank you.